for South Michigan. So on behalf of the American Heart Association, I really want to thank all of you for joining today. This is our third panel discussion in a series of COVID-19 community conversations. The American Heart Association is deeply concerned about the public health crisis facing our country. Our top priority regarding COVID-19 is the health and wellness of individuals and their families today and in the future, not only here in Detroit, our state, but in every community everywhere. This is a challenging time for all of us, and we really want you to know that we're in this together. Confirmed cases of the virus continue surging, and the state is responding by setting up field hospitals, extending the state of emergency, and approving hospital requests to increase bed capacity. It's our goal to keep you, the public, informed and to also provide you with the support and resources available through the American Heart Association and our valued partners during this time. I would also like to introduce now our moderator, Dave Sidlar. He is the Executive Director, Global Delivery Centers and Talent Acquisition at Allegis Global Solutions. Dave has more than 20 years of professional experience in executive search, recruitment, and workforce solutions. His current responsibilities include managing global RPO delivery centers worldwide, as well as global teams covering business analytics, international talent acquisition, and market research. Also, Dave is a volunteer extraordinaire for the American Heart Association and the better half to our board chair, Christy Sidlar. So Dave, thank you so much for joining us today, and I will turn it over to you.
Thank you very much, Laura. We are proud to have for you today an impressive panel of leaders who are renowned for their expertise both locally and nationally. Allow me to introduce Felecia J. Pryor, the Executive Vice President and CHRO for BorgWarner, Gretchen C. Goltz, DO and CPE, Medical Director for Provider Engagement for Blue Cross Blue Shield of Michigan, and James Joseph, Executive Vice President, Public Sector for HTC Global Services. Thank you all so much for being here today for this important conversation on employees' wellness in the midst of what we now are calling COVID-19. I'd like to jump right in and get started. Felecia Pryor, you are the Executive Vice President of Human Resources for BorgWarner. People are still adjusting to this new normal. For many, it's not only a means of working from home, but working from home while teaching children. How can companies work to support the wellness of their employees?
Yeah, so thank you so much. Thank you, Dave, for the question, and thank you to Laura and the team for inviting me to be a panelist on today's call. As an executive in the business, it became very apparent to us that we had to make a swift shift to allow for more of our employees, not only in the US, but globally, to have the opportunity to work from home. And in doing so, we realized straight away that we wouldn't necessarily have all of the resources that we needed, but we must provide as much as we can to continue that balance of work and of life. So one of the fundamental things that we did was to first ensure that everyone had the tools to be able to work from home. So we right away expanded our licenses through our service provider, WebEx, to allow for that. But most importantly, we have encouraged our managers, both at the senior levels of the company, but even our middle managers, to embrace what this opportunity provides. So we've given permission to allow for, dogs to be heard in the background and children to be, seen on the cameras. Those things are embraced for us because we understand that we have to be able to balance both sides. And working from home does provide a whole unique set of challenges.
Thank you, Felecia. Yeah, that makes a lot of sense. And I wouldn't be surprised if we heard some cats meowing in the background over here. You know, you also work with a global team. In what ways are you working to keep employees engaged around the world? What are some of the challenges that you face?
Yeah, so I mean, in terms of engagement around the world, we are at certainly different and varying levels. If you recall, and we all do, I mean, this started, in China, were some of the earlier cases that we started to hear about. And so actually one of the locations where we do business is actually in Wuhan, China, where the disease was first heard and known of. And so we have taken that China team as an opportunity for us to learn as we've kind of entered this stage of new normal for us. And so what they did a lot of was continue to stay engaged, with manager check-ins, continuing as much as we could, the online support of health and fitness classes where we could. And we've just expanded on that as it's come to now the US and Europe. So as an example, we do online fitness classes during the lunch break for our employees. That's one of the things that helps to keep them engaged beyond the work. We've also done some amendments to some of our healthcare plans to ensure that we're giving more opportunities for employees to seek employee assistance programs. At first, we only allowed for 3 or so of those opportunities under our plan, and now we've expanded that by 50%. We've also made sure that we've looked at other opportunities that we have in the space of healthcare, frankly speaking, increasing and amending our plans to allow for those who are on furlough or layoff to continue to receive their healthcare benefits during this time and for a longer period. In my words are, there would be nothing worse than for someone to lose healthcare at the most critical time when they need it most, during a crisis. So we've looked at our policies. We've continued to make time for fun, like I said, through the health and welfare activities, exercising online and offering those classes. But also some of those policy things were important too.
Great, thank you. Many companies are being faced with hiring freezes, cutbacks, and having employees who are directly affected by COVID-19. It's a challenging time. How can employers be sensitive to the emotional needs of their employees during this time? And I'll open this up to the whole panel.
Well,
yeah, I'm happy to.
Please.
Go ahead.
Go ahead, please.
Oh, okay. This is Gretchen Goltz from Blue Cross Blue Shield of Michigan. As an employer, we recognize the need to be attentive to the emotional needs of our employees. And from the start, Blue Cross has been very transparent with the information and assurance. And of particular importance to the well-being of employees who remain working on site. We've been very diligent in executing more robust cleaning schedules, increasing the availability of disinfectants, assuring that social distancing in the workplace. And we expanded our leave time provisions and other time off options to allow flexibility to our essential employees during this challenging time. But communication must be constant and needs to be open. It needs to openly recognize and offer assistance for the emotional needs of employees. So from the start, Blue Cross stood up an employee intranet site which continually updated information and expert advice on dealing with stress and anxiety around COVID-19, memos to employees and leaders, video messaging from our CEO, Dan Lepp, have been regularly sent out, keeping employees up to date on COVID-19 related changes and providing encouragement. We're delivering a series of employee webinars that openly discuss the emotional impacts and identify behavioral health warning signs and available resources. And employees are encouraged to take a break from work and from the news and find time for family and friends and exercise and relaxation. And leaders throughout Blue Cross Blue Shield of Michigan are also finding ways to create some virtual opportunities for teams to interact through activities like a virtual happy hour, online games, contests. And our webinar information asks leaders just to be respectful of employees' reactions and understand that not everyone is going to cope in the same way to all that's going on, to working in different environments and to the changes in their homes right now.
Great, thank you, Gretchen. Another one for all the panel members. For companies who have never had remote workers before, what advice would you all give them to support their employees during this time?
Well, there are a couple of things. I think this is James Joseph from HTC Global Services. I teach emotional intelligence, I teach meditation. So I would like to take that angle. These times of stress is an important opportunity for us to develop ourselves in terms of our maturity, in terms of our resilience, in terms of our inner balance. So this is a time that this is a great opportunity to be, you have time to self-reflect. Emotional intelligence basically consists of self-awareness, self-management, developing motivation, empathy, and social skills. And I will talk a little more about it as if there's time. But the most important thing to remember, which many of us do not, is that we have, in addition to our brain, we also have a heart, right? And we do not pay attention to our heart. This single act of becoming aware of your heart, the Heart Math Institute has published data to prove that the heart has a much bigger electromagnetic field than the brain. So if we can, as we interact with people, as we try to work together as a team, if we can also bring our heart to our work, we'll be much more effective and productive. And at the end of this session, I will give a little bit of introduction as to how this can be achieved, even in a very short time period. So in addition to providing the necessary connectivity and all that, I think the leadership has to ensure that the employees are, there's sufficient communication and given the tools to manage themselves so that they can be more productive, more effective, more stress-free.
Great, thank you, James. Gretchen, over to you. How is Blue Cross Blue Shield partnering with companies, to support its members during this time in the response to COVID-19?
Sure. In early March, Blue Cross Blue Shield of Michigan joined other Blue Cross plans nationally, announcing several initiatives designed to help members get the care they need during the coronavirus outbreak. These initiatives included waiving prior authorizations for diagnostic tests and medically necessary services consistent with CDC guidelines if they were diagnosed with COVID-19, fully covering any diagnostic tests related to COVID-19 with no cost share for members, increasing access to prescription medications, and waiving any early medication refills, encouraging and expanding access to telehealth and 24-hour nurse hotline care. And as the spread of the virus continued in Michigan, co-pays were waived for all treatment associated with COVID-19 diagnoses provided on an inpatient or outpatient basis. Prior authorization requirements were either removed or relaxed across all areas. Worked with suppliers to assure that medications that were needed to treat COVID-19 patients were readily available in Michigan hospitals. We monitored prescription drug supplies and provided flexibility in our formularies to assure that our members had access to their medications. And we're working with our self-funded employers. They get to make their own decisions on what they want to cover, but we're working with them on meeting their workforce needs. And then the strength of our provider network and our strong partnerships with physician organizations and hospitals uniquely positioned Blue Cross Blue Shield of Michigan to serve as a strong ally during this crisis. And we connected providers with needed resources like personal protective equipment, pharmaceuticals, and funding to aid in patient care. And then communication with our group customers and members and providers have been key in helping our stakeholders manage this crisis, keeping our customers and members informed of where they can get information on COVID-19, and continually posting information on our blog at mybluesperspective.com and other communication venues to inform them of the latest and national impact and provide counsel on what to do and where to seek care if members do become ill. We provide regular webinars for our employees and providers on COVID-19 developments and enhancements in members' access and funding. And we're also reaching out to some of our members that are most at risk through letters and phone calls.
Thank you. And you mentioned telehealth. Can you expand on that and tell us how Blue Cross Blue Shield has expanded its services during this time and when people should turn to use it?
Sure. Well, telehealth is kind of an umbrella term. So it applies always that information technology can be leveraged in healthcare. So through telemedicine, doctors and patients interact virtually using smartphones or tablets or personal computers. So it's become much more critical at this time as patients need to have active management of chronic medical conditions as they're sheltering in place. Blue Cross has been paying for telemedicine for almost 18 years. Initially, very few of our customers showed interest in covering this benefit, and utilization was relatively low. Obviously, most recently, the demand for that has expanded, particularly with COVID-19. And trying to protect our patients and our providers by keeping that distance and space. What we were able to do with our telehealth is representing a lifeline for both our high-risk patients and the healthcare system itself. And some of our healthcare systems had already installed telehealth infrastructure, and they were able to increase their telehealth visits from about 160 per week to over 7,000 visits per week almost overnight. And for the worried well and someone who needs to speak to a nurse, we have our 24-hour nurse call line, and they're providing access to a registered nurse to help members access those symptoms and provide guidance for next steps. For those members experiencing more complex symptoms, we have Blue Cross online visits. And these people are connected with a board-certified physician. And for those customers that had not purchased this option, we were able to fast-track a process to get those online visits available for their members as well. Blue Cross has waived cost share for telehealth visits, both for the online visits as well as through the in-network providers. That has all availability through telehealth and has removed some of the cost barriers involved with that. And we encourage members to call their primary care physicians first. Their own physician may have telehealth visit options available, and they can provide advice on care options as well.
Thank you. In what ways is Blue Cross Blue Shield helping support mental wellness during this time? What resources are available?
So we've added weekly webinars called Stay Healthy and Stay Connected, which are addressing topics which our employees on how to take care of themselves mentally, how to support those around them, and also to talk about the signs and symptoms to be aware of that can indicate when professional help should be sought. We're also taking care to ensure our employees are aware of any resources that are available to them, including our employee assistance program, our 24-hour nurse lines, that are staffed and trained in mental health, and any options for receiving any treatments through telehealth. In addition, our new behavioral health services cover substance use order treatment so that our members can continue to receive treatment in light of COVID-19. We're waiving cost share for the most common behavioral health services, such as counseling and medication review, for members with mental health benefits through us. And we're also providing telemedicine incentives and funding for the adoption of telemedicine for those providers that didn't previously provide it. And we're doing this through our physician group incentive program. We also have Blue Cross Coordinated Care Management Services, and we're reaching out to our high-risk members and seniors and those being most impacted by the virus by doing welfare and social isolation checks. And lastly, our provider Deliver Care Management is expanding their capabilities and connecting our members to their families when separated during hospitalization. And what this allows is during that time of quarantine, we're able to connect family members with the hospital providers and the care teams.
Great, thank you, Gretchen.
You're welcome.
James, this question is directed to you. How can a person who's working from home, possibly for the first time, overcome stress and set themselves up for success? Do you have any tips on scheduling, pacing your day? What can you tell us?
Well, the first question I would ask people is, to those who are participating in this called What is Stress? Stress is one of the best definitions of stress that I have heard is that stress is nothing but mismanaged emotions. For example, when we feel threatened, when we are afraid of losing, we have a need for security, a certain need for being safe, being certain. And when these things are coming into question, when they are threatened, that is when we feel stress. The need for security, the need for control, the need for appreciation, the need for differentiation. When these things are threatened, we feel stressed, right? Now, how do we manage that? There are many ways. There are short-term, long-term ways. But one of the most important things that we can develop in the course of managing stress is our own awareness. And I'll talk about it during the final session. Meditation, in fact, is a way of developing your awareness and attention. But on a short-term basis, what I feel is have a schedule for the day. And even before the schedule, if we have a clear idea of what is it that we want to accomplish in terms of goals, it gives us a tremendous sense of control. And it is very important for us. And even the schedule gives us control. But even in this schedule, if we can incorporate things like a little bit of workout, we can do push-ups, we can do a few squats, move our body around, circulate our blood, it really adds to reducing stress. And if we can incorporate some breathing exercises, for example, every hour, if I say I'm going to take 10 deep breaths, it doesn't need any special coaching or training. We know how to breathe. We have to breathe with awareness. Just take 10 deep breaths in and out and focus on your heart. Immediately your stress comes down. It is called coherence. Even if you breathe 5 times into your heart, for the count of 5, breathe in for 5, breathe out for 5, you will immediately start feeling your heart relaxing and a sense of coherence coming up, which will really help in coping with stress. And the other thing to keep in mind is before you have a meeting, for example, you're having a meeting with your team and it is stressful, take a few deep breaths, balance yourself, ground yourself, and you'll find that you'll flow in a much better way as the meeting progresses.
Great, thank you. Do you feel it's important to build time each day, since you mentioned scheduling, to build resilience and to release stress?
Right. So as I was saying, if you can schedule time in such a way that you get, some time, walk around when you're making a call, if it is not a video call, for example, and schedule time for exercising, schedule time for meditation, which is a very important thing. And the best time to meditate is in the morning, but you can also meditate when you have free time. And meditation is nothing but a scientific experiment. And I will explain that to you when we are during the session. It's a particular way of paying attention so that we develop that capacity for, to expand our consciousness so that we are not caught by all these belief systems that we hold within us. Because in a normal, we have something called the autonomic nervous system, which automatically kicks into gear into sympathetic and parasympathetic modes, depending on the threat level that we are perceiving. And these threats are perceived due to our belief systems, our perceptions. So we have to change our perceptions, and to change our perceptions, the best way is through self-reflection and self-awareness. And, these are some of the things that, you can practice by yourself. You can read, or there are so many workshops that are going on, YouTube videos, which would really help, because it is very important to develop ourselves, invest time in developing ourselves to become more productive in our work.
Great, thank you. So to all our panelists, what are some ways you are helping your employees remain active at home throughout the workday?
Dave, I'm happy to share. I think I shared earlier that we are still encouraging employees to participate in fitness classes. our company, BorgWarner, tends to offer a lot of health and fitness classes on site when we were doing business as normal. But now in these unusual times, we have taken those classes online. Another thing that we're continuing to do, and we do often, but usually, you know, we allow folks to pick up pamphlets or we do recipe classes, you know, on site at work. But what we are now doing, we're pushing those ideas to our employees. So giving them some, you know, healthy recipes from starting their day with fresh smoothies and fruits on to some of the lunch and dinner ideas to really kind of keep the health and wellness at the top. I had also mentioned earlier around the EAP class, the EAP benefit, the Employee Assistance Program. For us, I believe that's a critically important way, and really encouraging that through our leadership and our managers to have people participate in those options if they feel that they need it. And I love what Gretchen said about helping employees identify when they might need those resources. So those are just some of the ways. And I think, you know, our culture at BorgWarner is really a culture that embraces, number one, inclusion, collaboration. And so in everything that we do, I'm finding those behaviors and that spirit really resonating during this time, from the senior leadership down to even our factory workers. So I mean, it's just coming to life, even through these stressful times, which is good to see.
Great, thank you, Felecia. Gretchen, did you have something you wanted to share?
No, I completely agree with Felecia. You know, we're encouraging everybody to take their breaks and be healthy, eating well, don't overeat or stress eat. I think sitting at meetings and doing these Skype meetings and snacking, and kitchens are closer. Homemade food is much closer and accessible now. But I think also, just, you know, I was on a team meeting yesterday where we spent the majority of the meeting just reflecting what we're learning about ourselves during this time, and just taking that time to share stories with one another. We're definitely getting to know each other better as people outside of work, even though we always had really good coworker relationships. It's at a different level now when we are on a meeting and you see somebody's cat jump across the computer screen, or a dog barking in the background, or some child, you know, making noises or whatever. So I think just there's new levels of understanding and compassion, I think, being built in this time. And I think we need to make sure we foster that now and carry that forward.
Yeah, great, thank you. And that's a very good point. You know, the American Heart Association has some phenomenal resources to support employees in keeping active during this time. Every morning, Monday through Friday, from 9 to 9:30, their staff has access to free live at home workouts. The local team will share links to access these workouts on Facebook and YouTube. And if you want to jump out and take a look, you can go to Facebook.com/American Heart /live. YouTube is YouTube.com/user/American Heart ASSOC. And then obviously the website heart.org. You know, I'll add in a few things that we do here at Allegis, and what we found has been good for de-stressing and keeping our folks close and keeping people engaged. You know, first off, video calls versus conference calls. In managing teams globally, video calls were very common for me, but having just generic conference calls go to video has been quite a differentiator. And you know, I would be lying if I said that many of us didn't resemble memes that have gone around about what we looked like the first day, dressed in our suit and tie, and by day 15 it got a little looser. So it's a good way to keep connected and to be able to see your coworkers. You know, the other thing is phone calls versus emails. It is very easy to sit there and shoot out an email when you want to ask a coworker a question or when you answer. Much better for us to get on the phone and actually have a conversation. We really found that out the first couple of weeks. I've had a lot of folks say that while we always say it's better to talk than it is to email, in this case, it really has made a difference. I know one of you, I think it was you, Gretchen, mentioned virtual happy hours. I think within about 4 hours of us going into this whole lockdown, we had a Friday happy hour set up with a couple of our teams where we just get together on platforms like Zoom or WebEx and talk for a half hour, 45 minutes, enjoying whatever libation you may have. A couple of things that have popped up that you could argue might not be quite effective for making us more effective at work is, conference call bingo, the COVID edition. How many times can you mention quarantine, haircuts, or COVID-19 during a conference call? Again, it makes things a little bit more lighthearted, and especially early on when people were very stressed. These type of activities really help to make things a little bit easier. I've had groups that are doing weekly or daily games, just within their small groups. One of them was, how are you feeling right now? What was the last thing you ate? I will not tell everybody who the tired chocolate chip cookie was, but you may be able to guess. And finally, one of the things that a lot of companies do, and you all need to look internally for this, is Jabber or Yammer, those internal company networking sites. We have had a tremendous response to posting pictures of where you work today, where you're sitting, where do you move around in your home, posting pictures of your pets, posting pictures of your family and family activities, what you do with your family, what does school time look like with your children. All of these things help bring us a little bit closer together. And especially at a time where we're social distancing, it's something that we can all really learn from. So, Felecia, considering Michigan is a hotspot for COVID-19 and it's easy to get consumed by all of the bad news that's out there, as a global employer who have staff in areas all around the world who began fighting COVID-19 earlier than we did here in Michigan, what are you seeing globally as people begin to lift some of the social distancing rules?
Yeah, thank you. We are really seeing a lot more discipline, even though those rules are relaxing a bit, frankly speaking. So when you think about the teams that we have in China and in other parts of Asia Pacific, they are really deliberate about their processes, right? And so ensuring that the disinfection is happening to equipment, ensuring that people are wearing masks, frankly speaking, ensuring that they are focused on the people, the person, the place where they work, and how their actions impact others. And there's just a lot of discipline around that in places like Asia Pacific that, as I indicated, we're going to learn from, as we round the bend on restart here in the US. I think the US and Europe are very much in the same space right now. And so we're kind of working it out together. But what I've been hopeful of and what I've seen is more alignment globally around the basics, right? Taking those learnings from China. So if you think about where we sit in the US, months ago, it would have been a bit odd to see someone walking around in a mask, at work or in the supermarket. During my time living in China, it wasn't odd to me because people wore masks all the time, right? For pollution or if they weren't feeling well. And so I think the learning that is now we all have to come along on that, but we protect others and we protect the spaces in which we. And so there's not so much a relaxation happening as much as there is more discipline and purposefulness around how do we manage when we restart, if that makes sense.
Yeah, very much so. James, Gretchen, do you have any tips for helping people think beyond the current circumstances?
Yes. as I was saying before, companies spend a lot of time thinking about how they can improve, how they can prepare themselves post-COVID. I think at the same time, we as individuals should also look at how do we prepare ourselves and to observe the changes that we are going through, and how do we make ourselves stronger, how do we make ourselves more resilient, how do we make ourselves more balanced as we move forward, or as we prepare ourselves for the post-COVID times. And we can walk through some of this in the session that I'm going to facilitate after your concluding remarks. Is that
great? Thank you. Thank you very much. So thank you, panel. Those are some great suggestions, which leads me to our next segment. And James, you're an expert on guided meditation. Can you demonstrate briefly a guided meditation that can be used for stress reduction and increased productivity?
Wonderful. Thank you so much. I've been meditating for 30 years, and I teach meditation on a regular basis. The meditation I practice and teach is called heartfulness meditation. It's a little different from mindfulness because we are using the heart as the medium for meditation. And as I told you before, the heart is a very powerful field that we have. It's a brain by itself. It is the largest signal generator in the body. It is the lead organ in the body. And if you build a relationship with the heart, you're able to manage your entire system. So meditation is a way of achieving a level of improvement in your own being, state of being. So let's say from version 1, like we have in computers and phones, from version 1 to your highest version. It could be version 1000 or version N. So meditation is a process of working towards that to change your version from what you are today to a much higher version. And meditation also is a scientific experiment. And I'll very briefly touch upon that. All that we are is captured in our neural network, right? Whether we are happy or sad or intelligent or, whatever is captured in our neural network. And we really cannot change our neural network or neural connections through any physical processes. The best way to change our neural network is through changing the mind. And this is what the ancients discovered, that by changing our mind, we can change our brain. And how do we change our mind? There is many of you must have heard about the Heisenberg uncertainty principle, that by just observing, you can change a state of mind. So meditation is nothing but observing yourself in a particular way. So it is training your observation and training your attention. And in a short session, it is not, I can give you a brief taste of your own inner condition that you can achieve through meditation by your own process. You are the meditator. I'll just give you some instructions. So if you can close your eyes, if all of you can close your eyes for a few minutes. Take a few deep breaths. Become aware of your body. Allow the energies of the earth to rise through your feet and release and relax all the tensions that you're holding in your body. Feel your body relax from the tip of your toe to the top of your head. Now gently become aware of your heart, where it beats. Your heart is your greatest resource, your best friend. Make a gentle suggestion to your heart that the very source of light that is already present in your heart is drawing your attention in. We know that where our attention goes, our energy goes. So we are making a very gentle thought that our heart is connected to the source of light. Our thought is connected to the source of light in the heart. And that is where our attention is. Now step back and continue to observe the mind. If your thoughts wander, just bring it back. Bring your attention back to your heart. This is a state of meditation, and just stay in this state of meditation for a few minutes. And when it is over, I'll give you a cue and observe what changes that you observe in your inner condition. Well, you can open your eyes now. I know that was a very short session, but trust me, each time you meditate and you connect with your heart, you become a higher version of yourself. And this is something that is innately available to all of us. You know, we don't have to pay someone to learn this. It is very simple. And I teach this on a regular basis. If you would like to learn more, walk through more guided sessions, please contact American Heart Association. and we can arrange something that, we can all participate as a group, it really can make a huge difference in your life, because especially to cope with the stress that we are being faced with in this time of crisis.
Great. Thank you very much, James. So while I definitely feel a little more relaxed now, although it was slightly terrifying as the moderator, I did peek a couple times to make sure nobody was instant messaging me that we needed to move things along. So thank you. All of you, your commitment to the community and the overall mission of the American Heart Association drives impactful change in all of our communities. We are so grateful for each and every one of you, and thank you for bringing your answers and clarity to this community during this unprecedented and unsettling time. With that, I will hand it back over to Laura.
All right, wonderful. Thank you, Dave. James, I have had the great privilege of being in a few of your meditation sessions, and I was one of those that thought, nope, I can never turn my brain off to get into that state. And I remember the first time you came and tapped me on the shoulder and told me I'd been out for about 20 minutes and I was a new person. You are a gift, so thank you. As are you, Dave, Felecia, and Gretchen. It's not lost on us what a commitment and sacrifice that you have invested to be here with us today and share your words of wisdom and thoughts. It means a lot to us, and we're very grateful. And we just know that our hearts and our thoughts are there with all of the frontline medical professionals and all of the other folks who are out there risking their lives and giving everything to help us keep safe. So the American Heart Association definitely feels that and sees that. We're grateful for organizations that are listed here. We do have a list of fantastic sponsors that we will show, and they're lifting up our community. They're providing life-saving volunteer and vital financial support right now. We feel like together we can preserve and protect and continue to build healthier communities. In this new reality, there will be unquestionably new challenges for all of us as we press forward to achieve our mission. We look forward to continuing to collaborate with each of these very generous companies listed here and with all of you. Thank you very much for joining us today, for taking the time. Again, thank you for this dynamic panel, for such a great conversation, and to all of the attendees who gave us the attention and engagement. So a link to this full community conversation is going to be available on our Facebook page shortly. And we will also follow up with all of you with additional information. So with that, we want to close and let you know how very grateful we all are to you, and hope you enjoy the rest of your day.
Thank you so much.
Thank you.
Thank you, everyone.
Thanks, everybody.
Thank you.
Thank you.
Goodbye.
Have a good day.
Good day.
Thank you.
Thank you.